My name is Brandon White, standing beside us, Mr. Marshall. We're EMTs attached to the Jamaica Fire Brigade at the Portmore Waterford EMS site. Today we'll be demonstrating the BVM on an apneic traumatic patient. BSI, our scene is safe. We have one patient. I'm going to have ALS en route or I have ALS on standby. I'm now going to approach my patient in the line of vision, kneeling down to the patient. Sir, if you can hear me, please do not move your head. My name is Brandon White and I'm EMT. My partner and I are here to assist you at this time. My partner will come over and take over manual inline stabilization. I'm going to check the patient's level of consciousness. Sir, can you hear me? No response. Pain, there's no response. I'm going to check pulse for no more than 5 to 10 seconds, looking at the rise and fall of the chest. There is a pulse, but there is no rise and fall of the chest. I'm going to ask my partner to do a jaw thrust maneuver to look inside the patient's, to open the patient's airway. I'm going to look at this and feel for breath sounds. Also, their secretions. I'm going to use my suction machine, turning it on, building up to 300 millimeters per mercury. I'm using the appropriate suction catheter, the rigid tip suction, measuring the position of compound, measuring in the position of function. I'm going to insert the suction catheter and for no more than 15 seconds in a circular motion and suction on the way out. After that is done, I'm going to use appropriate size OPA, measuring the position of function from the corner of the mouth to the angle of the jaw. I'm going to insert, after which I'm going to use my BVM while my partner takes hold of mask while keeping the airway open, and I'm going to ventilate the patient one breath every 3 to 5 seconds, looking at the rise and fall of the chest. My patient has a gag reflex. I'm going to stop suctioning and stop BVM immediately. I'm going to remove the airway adjunct. I'm going to suction the patient for no more than 15 seconds once more, after which I'm going to continue to give ventilations at one breath every 3 to 5 seconds while keeping the airway open, and that concludes my demonstration of ventilating an apneic traumatic